Hi, I'm Dr. Wayne Burkholz with Total Performance Physical Therapy. Today we're going to go over a shoulder taping technique that really helps with people with bad posture. So when you see the person that has those shoulders that are kind of curled front, this tape is going to help pull them back into place. A few things that this tape does for you is, one, it helps to reduce shoulder pain almost immediately. The other thing is it helps to put the pecs in a really good stretch. This tape will last for about 2 days. So you're putting those pecs on a 48-hour stretch, which is a real good way to get started on treating the shoulder. So first thing you want to do, grab a box of cover roll. There are other manufacturers that make it. Feel free, you don't have to stick with this brand. You want to size this first. So as you come across the humeral head, you're going to come into a divot right here. You're going to start in that divot. You're going to come around and just make sure you're back on the scapula pretty well. So you're just going to size up the tape, and then you're going to cut it. Go ahead and make 2 pieces the same length.
Alright, so Old Street Road, now we have somebody cut the grass outside here.
Alright, so now you have 2 pieces of cover roll, the same length. Alright, you're going to start off, expose the area that you're planning to put the tape. Then you're going to take some tough skin. Once again, other brands make the same kind of thing. Feel free to use whatever you like. You're going to lightly coat the area that you're planning to put the tape. If you don't know what that area is, you can take the tape and lay it into place. The first piece is going to go right at the glenohumeral joint. So you're going to be just on the arm, just below where it rounds up onto the shoulder. The next one is going to be on the top, just above it. There's going to be a little bit of overlap so you don't have to take up a big space. All right. Turn your head away from me. Doesn't take much, just a light coating, and you're all done with that. Now you want to give that time to dry. It'll take a few seconds. In the meantime, try to get the curl out of this tape. It'll make your life a lot easier when you take the backing off of it and it gets sticky. If the stuff folds on itself, good luck getting it unfolded. All right. Almost dry. In the meantime, you can take the back off the tape. Alright, so we're good. So as I said, you're going to come right into the divot on the front of the shoulder. You're going to wrap around the back, just below like the corner of the shoulder. You're not pulling anything with this, you're just laying it down. Do your best to not get any wrinkles. If you have something that could be a wrinkle, just pull it tight and it'll flatten it out for you. Alright, now the next piece, this is kind of important. Make sure you don't have a gap in between the tape. So you don't want to put it like this where you can have the skin in between. You want to make sure that it overlaps, because if you don't, you can end up getting a blister in between the tape. So my recommendation is don't start in the front and lay it down, start in the middle. And I just ruined this piece because as I was talking to you, it folded on itself. If that happens, just take one of the backings of the other tape and size it up so you know that you're getting the right size.
Huntington Pike, who has Huntington Clark?
All right.
Okay, and you're working with directly with Allison on that? Because I know there's some challenges there with.
So like I said, start in the middle, make sure you're at the right spot, and just lay it down and lay it down. Now, when you're done with this, if you see some wrinkles, like right here's a wrinkle, it's a little tiny one, but it's on top of tape, not on top of skin, so you're okay. You just don't want it to be a wrinkle on the skin because that can cause an irritation. Next thing you're going to need is Leuco tape. Once again, different brands of this do exist. I like this one because it's super sticky and it doesn't stretch hardly at all. Right, so here you're gonna start about an inch away from the end of the tape. You're gonna run it back to about 2 inches away from the end of the tape, because as you pull it tight, you're gonna get closer to the end. You want to make sure you're about an inch away from the end so you have a nice anchor point. If you get too close to the end, you're going to peel the tape up. All right. So as I said before, you did not do any pulling with this tape. It's just basically giving you a base. Now on this one, you're going to attach it. Hold on to the attachment with your thumb and use your other hand to pull that back and lay it down. I made that just a little bit too long, so I'm going to trim it. If you are trimming while it's on the person, just be careful because you're taking scissors real close to the patient. And as you can see, her posture is already increasing. I'm already pulling that shoulder back. Then make the next piece the same size as the first piece you just put on. Now you're going to do the same thing. Start about an inch away from the end. Lay it down. Hold it in place with your thumb and pull it back. Alright. So the end result should look like this. But as you can see by her posture, it's already pulled her shoulder way back. Alright, give it a shot. Let us know how it goes.